CAT scans have become one of the most important diagnostic tools in medicine. More than 26 million patients get one every year. But now with the development of ultra-fast CAT scans, healthy people are paying to have them done as well. Critics say it's not good medicine, but advocates hail it as a revolution. So we sent our national correspondent, Jamie Gangel, out to check it out. Hi, Jamie. Good morning.
Good morning, Katie. Welcome to my hypochondria. These ultra-fast scans are still not widely available. They are expensive and they are controversial, but they also provide an amazing glimpse inside your body.
Welcome to the world of 21st century medicine. With the help of new computer technology, healthy people are lining up and paying out of pocket for this new full-body CAT scan, a virtual tour of their insides from neck to pelvis.
Take in a breath and hold it.
The scans are controversial. Many in the medical establishment think they're a waste of money and bad medicine. But advocates say patients want to know more about their health and that in the long run, this is important preventive care. Before undergoing the procedure myself, I went for my regular physical.
You haven't noticed any lumps or bumps anywhere?
No.
And my own physician, Dr. Mike Adams at Georgetown University Medical Center, gave me a clean bill of health.
Your bad cholesterol is nice and low, your good cholesterol is nice and high.
Good news. But like many other 40-somethings, I admit I'm among the worried well. Nervous there might be some ticking time bomb.
Would you ever do this for yourself? Would you be curious?
I think I would be curious, but I'm a little too nervous about what I'd find to do it. So I think you're brave.
Brave? Not really, but I am curious and probably a bit of a hypochondriac at heart.
Hi there.
So we went to Newport Beach, California, to the Healthview Center for Preventive Medicine, where they have patented this technology. First step, fill out a long questionnaire about your health history.
Have you ever been diagnosed with cancer? No.
Then, hand over your credit card. The scans cost $795, and it's rarely covered by insurance.
My name's Larry.
Jamie?
Then, it's picture time. The only preparation is a small Alka-Seltzer-like drink to expand your stomach for a better view.
That stuff is awful.
The actual scan is simple and fast, just about 15 minutes, and completely painless.
Let's take one more big breath and hold it, please.
No question, I was apprehensive, but as soon as the test was over, I couldn't wait to see the results.
What did you see?
I can't tell you.
So mean.
But don't expect a quick answer. After your scan, a doctor spends more than an hour going through every part of your body in detail.
This is your body.
My scan was reviewed by HealthView's founder, Dr. Harvey Eisenberg, a radiologist who has taught at Harvard and USC and has pioneered this technology and taken on the medical establishment.
I see this as an absolute inevitable necessity.
A strong believer in preventive medicine, even if you are in excellent health, Eisenberg's philosophy is the scan is critical to patient education.
This is not okay.
Take a look at my lungs, which have slight damage from secondhand smoke and a few foolish months of light smoking in college. Even though it was 25 years ago and I would never smoke now, you get a stern lecture.
I will not smoke. I got the message.
Okay.
Dr. Eisenberg believes a picture is worth 1,000 words. And in the world of medicine, where doctors often have a hard time convincing patients to take better care of themselves, taking a real look inside your body does have an impact. The tour is somewhat surreal, a checklist of your body parts.
We're looking at the stomach, and it looks entirely normal.
No sign of heart disease, no sign of cancer in any of the areas like the pancreas or kidneys that are hard to detect and often called the silent killers. The only other warning, no more jogging. My lower spine shows just the earliest signs of wear and tear. The good news, I have one of the cleanest scans Dr. Eisenberg says he has seen. On a scale of 1 to 10, I got a 9.5 and a sigh of relief.
So you've done very well, and I congratulate you.
Sure.
Okay?
Of course, my own doctor had already told me I was in excellent health. So why have this done?
There is almost no disease I can think of that you don't want to uncover as it's beginning, because that's when you can most effectively deal with it, and least expensively, both in terms of cost and human expense.
How often do you find something really serious in someone?
Every day.
Come on, really serious?
Every day.
Most often, Eisenberg says it's advanced heart disease that's been undetected. And in fact, a 3-year study at Walter Reed Army Medical Center backs him up. 15% of their patients were found to have significant heart disease. More rare but dramatic are patients like Tita Loza. 42 years old, she thought she was in excellent health. A fitness fiend who had never smoked, she did the scan on a whim and discovered she had stage 4 lung cancer. Loza immediately started radiation and chemotherapy.
I definitely think this test saved my life because I didn't have any symptoms. And I get a yearly physical. They didn't find anything wrong. So if it wasn't for this test, we would have never known.
But critics say these tests waste money, expose patients to unnecessary radiation, and because the scan is not foolproof, it can miss things or have false positives.
We simply do not have any scientific evidence at the current time to show that these are going to be either cost-effective or are going to prolong life for the individuals who undergo them.
But Eisenberg believes this is the start of a revolution, both for prevention and diagnosis.
I have no question whatsoever in my mind that this is the way medicine will be practiced. The public is banging down our door to get at this. Every patient that comes in here, whether it's a physician or a chief executive officer or the average layperson, really gets this. They really understand it.
In fact, there is a 7-month waiting list at HealthView. Most doctors I talk to do not approve of this. But I have to say it was an education, it was a relief. The one thing that's missing is they don't do a brain scan, a head scan, or legs, because an MRI is much more effective. And since I am, of course, worried about what my cell phone is doing to me, but that has to be done in a different test.
Okay, I've got lots of questions,
Yes.
Jamie. So proponents believe who should be getting this done and how often?
They still really don't know. That's a question to be answered. Eisenberg thinks it depends on your family history and if when you come in to do a CAT scan, they find anything. But he's suggesting it for people as young as their early 30s.
And critics say that there may be unnecessary surgery as a result, or people are going to be too neurotic and it's every little thing they're going to try to get.
See. It's not foolproof. There are false positives. That can send people in to have invasive surgery that they don't really need, and that has risks too.
And we should mention this would never replace a mammogram, a pap smear, at least right now, or my personal favorite, the colonoscopy.
Right, no, absolutely, you have to do those.
All right, Shane McGangal, that was really interesting, and I'm so glad you're healthy. Gee, bragging about it a lot, weren't you? I'm so healthy, I'm so healthy. Thanks,
so
Jamie.
relieved.
I'm relieved too, I'm glad for you. Anyway, at 7:49, we'll be back with more of Today right after this.